Welcome back to the PA Mastery Method. Here we're going to go through part 4 of my surgery EOR rapid review list that I put together for you. We've got 25 questions, Q&A style. Make sure you try to answer the question before the answer pops up to test your overall active recall. All right. So if a Crohn's patient is already taking 5-ASA, what would be the next thing to add? So we're going to add on budesonide oral. Basically, any steroid is going to be your next move once you start the 5-ASA. Which arrhythmia is caused by mitral stenosis? It's going to be AFib. How does progesterone influence the breast tissue prior to menses? So it grows the lobules and the alveoli. That's why there's this overall tenderness and fullness that people feel in the higher part of their follicular phase when progesterone is increasing. If a patient has lung cancer and high calcium, what type of lung cancer do you think they have? So these two things are going to be associated with your squamous cell carcinoma. Lung cancer with high calcium due to paraneoplastic stuff, things like that. Which condition will have a positive ASCA? That's going to be Crohn's disease. What kind of polyps do most colon cancers develop from? It's going to be your edematous polyps, and your chance of developing these cancers from these adenoma type polyps is going to increase with age. That's why screenings are later. If there's family members, we start at 40. By the time a patient's 50, they should definitely have their screening completed with a full colonoscopy. What type of kidney stone is associated with Proteus bacteria? That's going to be struvite stones. What medication is both a hypertensive and a treatment for prostatic hypertrophy? So you're going to use prazosin, any of the osins. Those are all going to help with bringing down that prostatic the prostate overgrowth leading to BPH. And the high fun symptoms, your urinary hesitancy and frequency, nocturia, that kind of stuff. If a patient has a history of heart disease and they're going through a dental procedure, what is the next recommendation? They should be on 2 grams of amoxicillin, taken about 30 to 60 minutes prior to the surgery or the procedure. What is the major difference between MVP and mitral regurg? It's going to be that the mitral regurg is going to radiate versus the prolapse doesn't really have that. The prolapse is the mid-systolic click with the late systolic murmur, whereas regurg has the radiation. What delta pressure, what is delta pressure when assessing for compartment syndrome? So it's where you take the diastolic BP and subtract the compartment pressure, and if that number is less than 30, it's diagnostic. What is going to be your initial treatment for toxic megacolon? And we're going to give IV glucocorticoids. If a patient is taking hydrocortisone for adrenal insufficiency, how should the dose be adjusted for surgery? You're supposed to increase it by about 5 to 10-fold. This will ensure that they don't go into a severe low state of cortisol, which is going to affect all of their healing abilities and kind of life-sustaining mechanisms that the body will do. What bacteria is a common part of post-influenza pneumonia with cavitation? So we're going to think MRSA in these situations. So if a patient has influenza and then develops pneumonia, we're going to be thinking MRSA is involved. What are the colon cancer screenings for a normal patient? What are these guidelines? Typically the CDC. So they say start at 45 years old, and we're going to be doing a colonoscopy every 10 years, or you can do a flexible sigmoidoscopy with a fecal blood test, or the FIT test, which is more for like the globulin sensors. So you can do either one of those, and then typically we stop at about 75. So if they start at 45, they're going to do it again at 55, 65, and then maybe one more time at 75. So most patients are only going to have 3 maximum in their life. What does Crohn's disease inflammation look like under a microscope? It's going to be transmural. You're also going to see your skip lesions, your cobblestoning. Transmural means that it's going through all the layers. I just think of Crohn's disease is completely diverse, and it can be found anywhere from mouth to anus, whereas ulcerative colitis is just the colon. So then what would ulcerative colitis inflammation look like under a microscope? It's going to be just the mucosal layers, so more superficial. What diagnosis aligns with symptoms of hyperthyroidism, then hypothyroidism after URI? So if they're going from hyper to hypo, this is subacute thyroiditis. What post-void residual volume indicates post-op urinary retention? It's going to be if they're maintaining more than 100 milliliters of fluid in the bladder. And at that point, we're likely going to have a catheter inserted. Peripheral artery disease occlusion in the aortoiliac arteries will cause pain where? So this is going to be the butt and the hip area. Think about where your aorta splits into your iliacs arteries. That's going to be right at that level. So that blood supply is going to be diminished with peripheral artery disease and causing that achy pain from the ischemia to that muscle. What is the greatest risk factor for gastric cancer? It's going to be an H. pylori infection. They might also put in NSAIDs and alcohol, other things like that, but H. pylori is the greatest risk factor. What is going to be the first step in treating a breast abscess? You're going to do needle aspiration and clindamycin. These things together, the aspiration will help remove the abscess itself, get rid of that pus, and then the clindamycin is going to be helpful for MRSA. What kind of breast lump is going to be fast-growing, hypoechoic on ultrasound, and has leaf-like projections on biopsy? So think of phylloides tumor with these. The leaf-like projection is pretty obvious. These ones are going to be also very quick to evolve, and then they're going to show up hypoechoic, so darker fluid type sac, but it's actually a tumor in this case. What surgical treatment is indicated for sigmoid volvulus without peritonitis? We're going to do an endoscopic detorsion with a rectal tube. Just don't get confused that we know NG tubes can help decompress, but essentially, if it's just the sigmoid volvulus, that's just the colon, so we're going to need to go the other direction, going with a rectal tube instead. What is the most common cause of a subarachnoid bleed? And that's going to be a ruptured berry aneurysm. All right, that's it for now. Don't forget to subscribe and see you in the next one.